Okay, I'm going to perform the postpartum assessment on my patient right here. Okay, so first I'm going to wash my hands, introduce myself, ask how she's doing, stuff like that. And then I'm going to assess her vital signs. I'm going to assess her blood pressure, pulse, temperature, respiration rate, and I'm going to ask, do you have any pain? Are you in any pain right now?
No.
No?
No.
Okay, that's good. Then I'm going to listen to her lungs. Okay? Can you take a deep breath in for me, please? Okay, again. Again. One more time. Okay, thank you. Then I'm going to listen to her heart. I'm going to listen to the aortic, pulmonic, second pulmonic, tricuspid, and the mitral areas of her heart. Okay. Now I am going to assess her bowel sounds to make sure that everything sounds okay. Okay. I'm going to lift your gown down. Okay. Everything sounds good so far. Okay. Okay. Now I'm going to have her sit up so I can check CVA tenderness and so I can listen to the backside of her lungs and her heart. Can you sit up for me, please, ma'am? Sit forward. Okay. I'm listening to her lungs. Breathe in and out, please. Okay. Now I'm going to check her CVA tenderness. Lean forward more. Okay. Does that hurt?
No.
Okay. Does that hurt?
No.
Okay. You can sit back now. Thank you. Okay. Now I'm going to assess her breasts to see if there's any red spots, if there's any cracks or open spots on her nipples. And then I could also ask her if her baby is nursing okay right now and how all that's going. So I'm going to look at her nipples. They look good. Next, I'm going to assess her uterus. So can you please lay down for me again? Okay. I'm going to pull this down a little. Okay. So the uterus should be somewhere around about 2 fingers below the umbilicus. So it feels like it's in the right spot, so that's good. And then I'm going to assess her bladder. I'm going to ask, when's the last time that you urinated?
1 hour ago.
And how, do you know about how much you urinated? About a cup?
About 2 cups.
2 cups.
Mm-hmm.
Okay. And then I'm going to assess lochia. I'm going to have her roll over this way. Can you roll over that way, please? and I'm going to be looking at the blood from her giving birth. So I'm looking at color, amount, consistency, and odor. Okay, so of course I would be wearing gloves. And I'm also looking to see if there are any clots or anything like that, because clots are no good. So, and then I'm going to look at the episiostomy. So I'd be using Rita to look for redness, edema, ecchymosis, discharge, and approximation for the laceration that was given to her before she gave birth. Okay, you can roll back over, ma'am. Okay, now I'm going to be assessing her Homan sign. Excuse me. Your baby is so cute. He is so cute. Okay, and I'm looking to see if she has any deep vein thrombosis in her legs. So I'm assessing for calf tenderness, any edema, any heat, redness, and then while I'm here, I'm also going to make sure that her reflexes work correctly. Relax your leg, please. Relax your leg, this part of your leg. Is it relaxed?
Mm-hmm.
Okay. I'm gonna make sure that her reflexes, and they do work. So that's good. And while I'm here, I'm also going to make sure and check out her dorsoflex function, okay? To see which it's also good. There's no clicking or anything like that, so she shows no signs of cloneness. I'm also going to assess her emotions, making sure that she's okay, making sure that she's doing well with her baby, if she has a name for her baby. Remind her that crying is okay, it's normal to cry because she just gave birth, so her hormones are all out of whack. So crying is normal. I'm also going to assess any skin changes because it is normal to have skin changes during pregnancy. One of them being mask of pregnancy, which would be on her face. There would also be stretch marks on her tummy, and then there would be, or there could be a dark line from her belly button that goes down, and then she could also be sweating a lot because before pregnancy before birth, before giving birth while in the hospital, she's going to be receiving a lot of fluids. And so after she delivers her baby, she has all these fluids in her body, and so the only way to get them out is to pee them out or sweat them out. So it's normal to have night sweats. Are you sweating at nighttime?
No.
No, you're not sweating?
No.
Okay. And then I'm going to talk to her about activity and nutrition. So drink lots of fluids, and you should have a high calorie intake, at least 300 more calories than usual, because you are breastfeeding your baby, so you have to provide for yourself and the baby, okay? And activity-wise, it's okay to do activity, but you just can't lift anything heavier than your baby, okay?
Okay.
Okay. And I would want to talk to my patient about postpartum depression, which happens a little bit after birth, a couple weeks to a month after birth, and tell her just kind of the signs of postpartum depression and about if she feels as though she can't care for her baby anymore, she doesn't have the energy to care for herself or the baby, anything like that, she would need to call her doctor. Okay, and that, I believe I got everything on my postpartum assessment checkoff. So, that's it. Thank you.